Hey guys, I hope you're doing okay. Today it's a really simple video. I finished a book last night that was such a good book, but it had therapy in it. And I just was like, the book would have been amazing. I would have 5-starred this book. I don't even want to say the name of the book because it got killed for me. And I can't 5-star the book. It was so obvious to me that the author did not understand how therapy works. And because of that, it really just crushed the book. Now, maybe for other people, that book would have been awesome because they don't know and they're thinking, sure, people walk into a therapy room and instantly have a breakthrough. 2 sessions later, their life is figured out. That is not how therapy works. And then it occurred to me, I get authors all the time and props to them. They will come to me and say, Erin, I don't know, how would this work with a child custody case? How would this work with borderline personality disorder? How would this work with DID? Whatever the diagnosis might be that their character's going through. And I'll talk to them and give them as much information as I can. A lot of times it's legal stuff, like would the client's information be released to the public or that kind of stuff. But they're doing their due diligence with research when it comes to therapy, and putting factual stuff in these books. But unfortunately, this book, which was by a big 6 publishing company, so I am just shocked that the editors didn't say, wait, hold up, have we fact-checked this at all? Because it was just so unrealistic. In this book, the way that it went down was that the character showed up in a session and within 2 sessions had this breakthrough because this therapist was just so wonderful. Well, number one, no therapist is that wonderful. I promise. We're not magicians. But number 2, it just, the way it was done, no. The client in question would have needed what is called CBT therapy. And CBT therapy is at least a minimum of 12 sessions. So it made me think, okay, let's talk just a little bit about what you want to put, or be sure, the very basic stuff, so that you're not alienating anybody with a psych background, and letting them know I basically didn't research. When you are writing a book, and it is very common because it's a great way to really get insight into a character, is to show us their therapy sessions, right? Lots of authors do this. I do it all the time. But when you're doing this, what you want to do is, number one, you never want less than 12 sessions because it's not realistic. Unless they're firing their therapist, great, then it could be 1 session. The first, say, 3 sessions are just get to know you stuff. So I don't know that I would even write a lot about those, maybe how the character felt, their impressions of the therapist, all of that. But as a therapist, I could learn to speak, that would be good. But as a therapist, we are really looking to kind of get the big picture. There aren't a lot of deep questions in the first few therapy sessions. That comes down the road. The first thing that a therapist will do is form what's called the Therapeutic Alliance, which is basically spending time getting to know the client, understand their background a little bit, maybe not every childhood story. A lot of people think that too, that therapists spend a lot of time talking about the past. And while that is true for some therapists, in modern times, that is not the case for most therapists. Most therapists are very what they call solution focused and very in the now. Yes, there are therapists that will go backwards into your past and all of that, but most therapists are what we call client driven and solution focused, which means that they are very hands off. They're not directive. They don't tell a client how to live their life. They are trying to encourage the client to live their best life. So as an author, you want to have the therapist be a little more hands-off. Now, if you're writing about a psychotherapist, yeah, great. Have them control the client every step of the way, because that would be maybe not unethical. It depends on how it's done, but that would not be the norm. But rule 1, I think, when you're writing about therapy is don't introduce them to the therapist. They hit it right off. They trust each other right away. Reveal all the secrets right away, and then boom, they're cured on session 3. That is not how therapy works. At least you want a minimum of 12 sessions. Realistically, if you want a quote breakthrough, you need like years with the therapist. You want like 2 to 3 years of regular sessions. And when I say regular sessions, that would mean for most clients, it's about once every 2 weeks, sometimes once a month. For a client with a pathology that's really kind of intense, once a week. If someone's in crisis, a therapist would see a client about once a week. So you want to pay attention to that too. But I guess the thing that I really want to encourage authors to do is do some research. If you're going to throw a character into a therapy room or into a treatment center, that's another thing. I've read books too where they've got people in group homes or residential settings, and I don't know if it's that the author has never done any research on it, if the author is just making assumptions based on what they see on TV, but group homes and I mean, it depends on if it's a recovery center, if it's depends on why the client's there, but it's a very structured day, and there are usually at least 2 sessions a day of group therapy. Then you also have individual therapy. There are layers upon layers to how those groups run, and I will watch someone put someone in a group home, and it's like they just spend the whole day talking to the other people in there, which, yeah, you have time for that, and there's a rec room generally, there's art therapy, we're all working together, but it's usually pretty structured. It's not as like what I will read in fiction books a lot is people sort of just like hanging out, and once a week they go to group therapy, and that's not it. But anyway, back to the basics of individual therapy with a character in a book. You want at least 12 sessions before there's any big breakthrough. You want at least 6 sessions before they even sort of clicked with the therapist. I'd rather have star 6 months later than unrealistic therapy going on. Obviously, therapy is not usually the point of the book, but if you're going to have that in there, make sure you're timing that right. You can't just have a breakthrough instantly, or if you're going to do that, then you've got to say, it's been 3 years with this therapist who Sally trusts. Another thing is, no 2 therapists are the same. Every therapist has their own style, their own way of approaching trauma, their own way of approaching grief. Like I said, most modern therapists are pretty hands-off. They want you to live your own best life and do you the way that you believe you should live. It's very, be you. It's not be me or be what I believe that you should be. So you want to be careful about how the therapist is working with that client. You also want to really think, therapists are not as, we label clients, as in like diagnose, because we need a billing code. We need to be able to say, this person has schizophrenia and that's this number in the DSM. We want to label that. But in the actual therapy room, the emphasis is not so much on labels as it is on the person. So you wouldn't unless the character was having an issue with their diagnosis, the label would be almost unsaid. It's sort of like show, don't tell. You want to use that same technique when you're writing about therapy. You do a lot more showing, not telling. Don't tell me this client is schizophrenic. Show me that. Show me that one day the client came to therapy dressed completely conservative, very quiet, maybe really standoffish. And the next day they came in there completely flamboyant, tons of makeup, just totally outgoing. Show me the different alters instead of just telling me about the alters. And show me how the therapist responds differently. A good therapist is not going to interact the same with any 2 clients. They're going to meet the client where they're at, remember? So you want to show that. If you're writing about a client with MPD, you, or multiple personality disorder, you want to show the therapist using sort of a different therapeutic modality with that client. You want to show the therapist is the one bending to meet the client where they're at, not the client bending to meet the therapist. If you do that and you don't do those breakthroughs right away, and you ask, don't be afraid to ask. Ask, and this goes with everything. It's not just therapy. You know, if you're writing about a crime novel and you don't know anything about being law enforcement, go to someone and ask. Military, find yourself a veteran. Ask, and when you do that research, it will pay off. Your readers will see it, because sometimes your reader is exactly who you're writing about. And trust me, that book would have been brilliant to me, but no, nobody has a breakthrough in the second session. They just don't. Okay, guys, thank you for watching. Happy writing. I love when the therapy sessions are in the book, so don't be afraid to try it. I'll talk to you guys soon. Until next time, peace, love, books, and crazy.